Hello, my name is Allie, and I will be walking you through the effects of hypertension on the eye. As an introduction, normal blood pressure is a systolic of less than 120 and a diastolic of less than 80. Patients who have a systolic between 130 and 139 or a diastolic between 80 and 89 have stage 1 hypertension. Patients with a systolic greater than or equal to 140 or a diastolic greater than or equal to 90 have stage 2 hypertension. Risk factors include increasing age, obesity, family history, alcohol, and smoking. And systemic hypertension has many effects throughout the body, but on the eye, it directly affects the retinal, choroidal, and optic nerve vasculature. So before we dive into the pathology that's found in the eye as a result of hypertension, let's review some normal anatomy. Here you can see the optic disc, here is the macula, here's the superior arcade, and here's the inferior arcade. You'll also notice that I've labeled the patients right and left at the bottom of the slide. You can determine whether you are looking at a right or left fundus by the relationship of the optic disc and the macula. The macula is always temporal to the optic disc, and since the macula is to the left of the optic disc in this photo, you know that you are looking at the left eye. Hypertensive retinopathy is damage to the retina secondary to elevated blood pressure. Black patients are more likely to have hypertensive retinopathy than white patients, and those who have signs of hypertensive retinopathy are 2 to 3 times more likely to suffer from a stroke. Hypertensive retinopathy is detected through fundoscopic exam, and findings are almost always present bilaterally. Treatment is through blood pressure control via pharmacologic therapy and lifestyle modifications such as smoking cessation, weight loss, diet with fruits and vegetables, decreased sodium intake, physical activity for 30 minutes daily, and limitation of alcohol. And 5-year survival for patients with hypertensive retinopathy is 70% if there's mild arteriolar narrowing on fundoscopic exam, but only 6% if there is optic disc swelling. So fundoscopic exam findings vary according to the severity of the hypertension and also the rapidity of its onset. So among the earliest findings in chronic hypertension are retinal arteriolar signs. This includes focal and diffuse arteriolar narrowing, arterial wall opacification, and arteriovenous nicking or AV nicking. And AV nicking occurs when arteriosclerotic vessels compress retinal veins. AV nicking is not indicative of patients' concurrent blood pressure measurements and is therefore considered a persistent marker of chronic damage. And here in this image you can see a good example of AV nicking. Copper wiring is another sign of chronic hypertension, and when light reflects off of an arteriosclerotic vessel, the vessel appears kind of like a metallic wire. So in copper wiring, this metallic appearance is only in part of the vessel, so you can see that the center of this vessel is kind of yellow, but the very edges of the walls remain red. Whereas in silver wiring, the metallic appearance is throughout the entire span of the vessel. Flame-shaped hemorrhages, dot blot hemorrhages, cotton wool spots, and microaneurysms appear later in the course. Flame-shaped hemorrhages have a feathered appearance and occur within the nerve fiber layer, while dot blot hemorrhages have a rounder shape and occur in the inner nuclear and outer plexiform layers of the retina. Cotton wool spots result from nerve fiber layer ischemia and appear as small white areas on the retina. Hard exudates are small yellow areas of lipids that have leaked through retinal vessels, and you can see examples of those here. And lastly, optic disc edema is among the last signs to develop from hypertension and carries a poor prognosis for vision and survival. While you can see distinct margins on the left side of the optic disc in this photo, it's hard to make out the margins on the right side, demonstrating that optic disc edema is present. Hemorrhages, microaneurysms, and cotton wool spots are associated with concurrently measured blood pressures and are therefore viewed as more transient signs of damage. In addition to having a direct effect on retinal vasculature, hypertension increases the likelihood of developing several other vascular disease in the eye. Among these conditions are central and branch retinal vein occlusion, central and branch retinal artery occlusion, retinal macroaneurysm, non-arteritic anterior ischemic optic neuropathy, and diabetic retinopathy. This image demonstrates central retinal vein occlusion, which is characterized by diffuse retinal hemorrhages, macular edema, and cotton wool spots. And you'll notice that the hemorrhages in this photo are present throughout the entire picture. In contrast to the previous photo, this image represents branch retinal vein occlusion. This condition has the same findings as CRVO, except the findings are present in a focused area of the retina. And here you'll see that the hemorrhages are more in just this area rather than the entire photo. This image shows central retinal artery occlusion, which occurs primarily in patients with hypertension and is often due to an embolus secondary to carotid plaque. Patients will experience sudden painless vision loss in one eye, and classic findings include a cherry red spot in the macula and diffuse retinal whitening. The macula remains red as it is not supplied by the retinal artery, but rather the long and short posterior ciliary arteries. And in contrast to central retinal artery occlusion, branch retinal artery occlusion affects only a branch of the retinal artery, so retinal whitening will be a focal rather than diffuse finding. Although these patients will present with visual field defect, loss of central vision can be minor. Another vascular complication of hypertension is the development of a retinal macroaneurysm. Visual prognosis is generally good, but loss of vision can occur secondary to macular edema or aneurysm rupture. Of note, this picture also provides a great example of macular star of exudates, which can also be present in hypertensive retinopathy. So in summary, the early findings of hypertensive retinopathy include arteriolar narrowing, AV nicking, and copper or silver wiring, while late findings include dot blot or flame hemorrhages, microaneurysms, hard exudates, and optic disc swelling. Additionally, vascular complications of hypertensive retinopathy include central or branch retinal vein or artery occlusion, retinal macular aneurysm, NAION, and progression of diabetic retinopathy. I used the following sources to prepare this module and took all of the photos from the AAO website. And lastly, I would just like to thank everyone for watching this module, and I would also like to thank Dr. Kaplan and my fellow med student Mason Shaner for their help and feedback throughout the preparation of this module.